Every 20 seconds in this country, somebody develops diabetes. It's such a common problem. So I think a lot of people can benefit from more insight. And right now, our sugars are fluctuating in our body, and our brain is detecting that and giving off signals on the surface of the brain that can be captured by EEG. And these signals are paired with novel deep learning techniques. The AI revolution really does give us the ability to develop something very practical and make it readily available for the many millions of Americans that need it.
Welcome to Digital Health Disruptors, a podcast brought to you by Charm Health. I'm your host, Ranjini Rangan. Welcome, Disruptors. Now picture this, a future where managing your health doesn't rely on the prick of a needle or the swipe of a sensor, but it taps directly into the electrical symphony of your brain. That's not sci-fi, that's Synch Neuro, and the potential of EEG-based continuous glucose monitoring, a technology that may just revolutionize diabetes care and much more. Our guest today, Dr. Casey Halpern, isn't just a neurosurgeon. He's the chief of Stereotactic and Functional Neurosurgery at the University of Pennsylvania, where he's leading efforts to treat conditions like addiction, OCD, and compulsive behaviors using deep brain stimulation and neuromodulation. Now, Dr. Halpern is bringing the same surgical precision to the world of health tech, and with Synch Neuro, he's asking a provocative question. What if your brain could tell you when your health is slipping before your body even knows? Today, we explore Dr. Halpern and the team at Synch Neuro, who are building a sleek, behind-the-ear EEG device that fuses brain data, AI, and personalized medicine. Not just to track glucose, but the potential to unlock insights into blood pressure, stroke risk, epilepsy, arrhythmia, and sleep health. So if you're curious about the next frontier of wearable tech, brain-machine interface, and what it truly means to put health back into the hands of people, you're going to love this episode. Let's jump in. It's a pleasure to have you here, Dr. Halpern.
Thanks for having me.
What inspired you to become a neurosurgeon?
You know, I've always been interested in the brain and being a doctor, and saw my inclination to be a people person and love science early on. So it was an early inspiration. My bus driver in sixth grade also told me he thought I should be a neurosurgeon, so I had to follow suit. That's a true story.
Your bus driver.
Yeah. It's all about the people you meet in life. Often you're influenced a lot by the people you have the opportunity to connect with in life. And if they're kind and inspiring, it generates usually the kind of career I've pursued.
As a neurosurgeon, what does your day-to-day look like?
Yeah, I practice a very deep subspecialty within neurosurgery. Run a division here at Penn called Stereotactic and Functional Neurosurgery, where we help people with quality of life. And we use procedures like deep brain stimulation and focused ultrasound. These are elective procedures. People opt to take on a small risk of surgery. The brain surgery can be terrifying to people, but the procedures we do are minimally invasive and generally very well tolerated. They can also be transformative for people's lives. I saw one of these surgeries when I was a sophomore or junior in college here at Penn, performed by Gordon Baltuck, who was one of my mentors, and I never wanted to do anything else. I mean, the patient cried on the table with the feeling of relief when his tremor went away. And I still do that surgery in the exact same operating room that my mentor did. And I can also run a research laboratory. We study aspects of mental health that can be treated with deep brain stimulation, severe OCD, addiction, even eating disorders associated with obesity. And it's that work that inspired the sort of more entrepreneurial focus that this part of my career seems to be taking on.
Wonderful. So before we get into Synch Neuro, Dr. Halpern, I wanted to talk about your exposure to compulsive behaviors and obesity beyond your professional. Can you share pivotal moments that deepened your commitment to these conditions?
Sure. Compulsion is a problem in the human condition that can be modeled in the research laboratory, but it really is a pathological problem that is very unique to humans. We tend to take risks and put ourselves in danger because of a reward that we want. You know, in the wild, when we were hunters and gatherers, the ability to seek out food and put ourselves at risk, that was probably an evolutionary advantage, because if we were successful getting the food despite the risk, then we survived. But now in a world where or in a country at least, where food is so readily available and highly refined, has now become a liability. That type of compulsive behavior is something that we see in eating disorders and obesity, but we also see it in conditions like OCD and substance abuse disorders, addiction, alcoholism. These are very common problems affecting 50 million Americans. The most dangerous compulsion is suicide. We've all been touched by these problems directly through family or friends, people we know, not understanding why some of my friends were having difficulty controlling how much they were drinking in college, opting for doing things that I just felt were quite dangerous. I never really understood that. I felt like it really shouldn't be something that was part of our condition, and I thought about developing treatments to address the severest of cases, the pathological examples, which relate to things like OCD and severe eating disorders, things like that.
I hear an element of compassion in your voice and the motivation. Most people see prediabetes as a metabolic issue, but you see it as a brain problem.
I think it's twofold. The brain constantly surveys our body, and it has mechanisms of monitoring our blood sugar. It's very interested in what our blood sugar is because it's a highly metabolic organ itself. So in order to ensure survival, and going back to evolution, it was very important for our brain to be able to track our blood sugar, even anticipate what the blood sugar may be based on stress and sleep, and really help guide behavior so that we could avoid starvation. Now, that type of food drive is a liability. We have a problem, but we also have an opportunity. The brain is not necessarily functioning in that way pathologically. It's doing what we've evolved to do. We just haven't evolved to live in a society where food is so readily available and so highly refined. It's an opportunity because we can tap into this and harness the brain signals. The brain gives off signals or biomarkers that reflect what our blood sugar is and may be. And we can develop tools to detect these readouts to really provide insights into our health, much like what a continuous glucose monitor does.
Also known as CGMs, a tool for those with type 1 or type 2 diabetes. Traditionally, a finger prick would measure blood sugar indirectly from the interstitial fluid under the skin. They're fairly accurate, and they're well validated by the FDA, but often there's a 15-minute delay in receiving the information. Well, I'll let him tell you.
I don't see our conversation as a chance to air grievances against CGMs. I actually think they're fabulous technologies. CGMs, they've helped people with diabetes, for sure. However, they're really only good at providing insight into what your sugar is right after a meal, assuming you recognize that there's about a 15 to 20-minute lag on that. They don't capture hypoglycemia, which can be a lethal event, by the way, in people with diabetes, especially if they're getting insulin. And they don't track blood sugar very well otherwise. And glucose fluctuates for so many important reasons. They could probably reverse type 2 diabetes through two separate strategies. One would be try to prevent the big postprandial spikes. So after a meal, your sugar spikes a lot. So learning to eat the foods that don't cause those spikes so frequently and so robustly, that would be important for people with type 2 diabetes. People with type 2 diabetes don't realize from standard CGMs is that their glucose fluctuations are significant during other periods. They can be significant during sleep. They can be significant during waking hours, before and after exercise. And the CGM is really not able to tell them accurately what those fluctuations are. And part of that is because the signal is not strong enough to go above the noise. And so it really goes unnoted. And those are big opportunities to improve your health, but you can't see them.
Enter Synch Neuro. A non-invasive monitor is placed behind the ear, and the data collected is instant. When coupled with AI to decode the data, the real magic happens, a seamless synergy between the brain's natural intelligence and cutting-edge technology.
Our data source is the brain, which is continuously monitoring. And we intend to be able to give people insight into what their blood sugar is at all times. We can give people insight as to what their sugar may be in the very near future, so they can actually get ahead of it. But we can also help people see the relationship between their sleep quality and their stress and their blood sugar, not just the food that they choose to eat. I have prediabetes. When I wore a continuous glucose monitor, I had fairly benign swings when I was eating. So why do I have prediabetes? Nobody can really tell me. My endocrinologist, who's a good guy, but just said, you're probably a little healthier than you realize. The number just doesn't make sense for you. And I have a tough time believing that. My A1C is 6. So, that means I have some risk in my life. And I'm completely in the dark as to what I can do to make it better. And I've tried everything. I suspect it's something about my sleep. So by extracting sleep features from the brain rhythms, we can actually provide insights into what your blood sugar is going to be tomorrow. And so I'm very hopeful and optimistic that our technology will be able to give me and many people like me insight into how to make my sleep quality better, more routine, and how it can interact with my metabolism and my meal choices and the timing of my meals to improve my metabolism.
Why is this all possible now? Is it because of the convergence of advanced machine learning, sensors, and data? What has changed?
It's all about timing. There's companies focused on brain data invasively, non-invasively, through the NIH, thanks to President Obama. Huge amount of research that is getting the attention of the New York Times and other media sources. The brain provides so much information and reflects our health in so many different ways. In that regard, there's no better time. In addition to that, there is hardware technologies that are readily available that would make building a wearable for the brain fairly affordable, actually extremely affordable, much more affordable than trying to build a interstitial fluid monitor like a CGM. So that's technology like EEG, which has been validated for decades. Synch Neuro really for the first time is using EEG to understand our metabolism, our cardiac health. And we can do that because brain data continuously reflects our metabolism. Right now, our sugars are fluctuating in our body, and our brain is detecting that and giving off signals on the surface of the brain that can be captured by EEG. And these signals are fairly robust. It can't be a noisy signal. But because of new hardware synergized with novel deep learning techniques, the AI revolution, that really does give us the ability to develop something very practical and make it readily available for the many millions of Americans that need it.
Coming up, how Dr. Halpern and his team unknowingly set the stage for a breakthrough, plus how he did all of it without the use of any grant money. In a groundbreaking study at Stanford University, Dr. Halpern and his team dove deep into the mysteries of the brain's role in regulating metabolism, specifically blood sugar levels. With approval from patients and ethical oversight, they implanted electrodes into the brain of participants.
Because I do deep brain stimulation surgery, for clinical reasons, we had electrodes in the brain when I was at Stanford University as faculty. And through an IRB-approved research, while these patients were implanted with these electrodes, we were able to ask a very critical question. And that was, how does the brain interact directly with metabolism? So we actually placed continuous glucose monitor on these patients with their approval and consent. And we anticipated that patients, when they were hungry, that they would be hypoglycemic, that their blood sugars would be relatively low. And one reason we would seek out meals was to try to normalize our blood sugar. And indeed, that proved to be a reasonable hypothesis. But what we also realized was that the brain continuously monitors, because it matched the continuous glucose monitor when we decoded the brain signal, synchronized in time to the glucose monitor. Using machine learning techniques, we could actually tell you what your blood sugar was, and we even could provide a very accurate prediction as to what it could be.
Just a totally proactive, predictive mechanism where you can see what's going to happen.
Personalized and proactive. I could help you get ahead of your spikes before they happen. I've always believed in being very intentional, but if you're constantly intentional, which kind of manifests as being overly restrictive in your dieting, we know that that's not sustainable. Caloric restriction sort of a diet has been demonstrated to actually worsen things like eating disorders. So I never wanted to develop a company that sort of pushed for restriction. I don't really believe that there's bad foods. Some people need to avoid certain kinds of foods, maybe. That doesn't mean that they can have zero of them. I do think that we can guide lifestyle and that it's very personalized. Our app will do it. It'll help ensure compliance in that way. That's probably our most important interface with our patients. They can input what foods they eat, and the algorithm can give them a sense as to what foods are good for them. This is not a time for a high sugary breakfast, and you might want to do some cardiovascular activity right now. That'll help prevent that spike, or have some apple cider vinegar, for example. So we can give people prompts in the morning when they wake up about what their blood sugar could be and what they should do to try to prevent those swings from happening.
So you've created a device that sits behind the ear. Can you take us to that moment when you first realized EEG could predict glucose levels?
What was particularly unique about that finding was not just that we were able to decode brain data to track blood sugar. That obviously was really novel and exciting. But what was very unique about it and gave us this entrepreneurial opportunity was that the signal was very diffuse. The computational power of my team when I was at Stanford, now at Penn, I mean, it really is incredible. I said, tell me a little bit about how does this signal propagate in the brain? And what they said that was particularly exciting to me was that the hypothalamus seems to be a hotspot. The hypothalamus is part of the brain that's known across endocrinologists and endocrinology laboratories to monitor our metabolism and guide and orchestrate our metabolism. And this has been done in rodents, large animals, and humans using functional imaging. But what we found was that connections to the hypothalamus, which reached the surface of the brain, also did that functions. In fact, almost every region of the brain showed this ability, and they reached the surface of the brain. So it was a highly distributed phenomenon. And when you have surface level activity, the next logical question is, well, that signal probably could be detected completely non-invasively with EEG. So intracranial EEG was the data source we started with. And since the signal was surface level, we were able to move out of the brain. And that was the purpose of forming Synch Neuro. Could we do it with a pair of electrodes? I was worried that the frontal lobe, which is a big lobe of the brain, would be a necessary area. The problem with that is you'd have to wear electrodes on your forehead. And perhaps people would be willing. I just don't think many millions would be willing. I wanted to build a wearable that could scale to the 100 million Americans that have prediabetes, and if not 100 million. So we actually found that the signal was particularly robust behind the ear. And the reason for that is because the bone quality behind the ear is fairly thin and hollow. And so a brain signal can be detected there fairly robustly. And so that gave us the confidence that not only could we do surface EEG or non-invasive recordings, but we could do it with a discrete wearable that people would be willing to wear 24/7.
Wow, what a finding. Must have been just like mind-blowing.
If you can believe this, none of this work has ever been funded by a research grant. We've had NIH grants funding parallel research, but actually the staff and team that did the majority of this work, they were just neuroscientists super excited about the brain and really interested in this hypothesis. So we've raised $3 million in angel money from investors, friends and family, and just very kind and generous individuals to support where we're going. Now we're moving into trying to be venture-backed.
Exciting times. What part of this is proprietary? You said that you've been able to find signals from the hypothalamus. I'm like on the edge of my seat going, is he giving away something that he's not supposed to?
No, don't worry. I'm well coached. Before I formed my company, early on when I was still at Stanford, I generated IP at Stanford from my lab. So Stanford owns some of this IP. And we learned that first we had to protect some of these ideas. So we did that. And then I realized if I was going to incorporate, I had no idea what that meant. I needed a lawyer and I needed a sort of a business advisor. So I was connected to Jim Shea, who's a very well-known patent attorney in the Valley. He introduced me to one of his proteges, Tom Zlager, and Tom continues to be our patent attorney and helps us with our day-to-day as well. And he introduced me to Barry Cheskin, who is our sort of lead business advisor, serial medical device entrepreneur. And they've been my sort of Yoda ever since. We've licensed the IP from Stanford, so we have exclusivity to that. And since company formation, which started in 2021, we filed at least a dozen patents. And we've also had some claims allowed by the U.S. Patent Office. So there is so much more to do. We've just scratched the surface. I see this hardware and software being applicable to so many health states. And also, we need so many more readouts about metabolism other than blood sugar.
Coming up, how real-time metabolic monitoring is rewriting what we know about addiction, obesity, and sleep, offering a window into our bodies. Then, navigating the skeptics. As you build your proof of concept, their doubts may sting, but they just might forge your idea into something bulletproof. And what does Dr. Halpern really think about the competition? This episode is brought to you by Charm Health. Health entrepreneurs, if you're building innovative solutions, Charm Health is the place to test, iterate, and grow. With a community of eager early adopters from large physician groups to multi-specialty clinics, take your vision and disrupt the space with a little help from Charm Health's supportive ecosystem. Drop us a line at marketplace@charmhealth.com. So we talked about it being 26 electrodes, and your team has found a way to scale it down. And you've also talked about sensors being super small now. Are we there already? What's the biggest engineering or research hurdle in achieving this?
The hardware is there. We have breadboard prototypes, highly functional. We've identified a manufacturer. So from a hardware standpoint, we're good. All flexible electronics, Bluetooth technology. These are fairly standard tools. So that part, we're solid on. The machine learning technologies are also there and available. The hurdle that we have is we need to run a study of about 600 individuals in order to max out our accuracy, our predictability, our proactive personalization. The good news is that study is going to be a 2-week-long study, and people with prediabetes, it's not going to be hard to find people to participate. We will run this study somewhat virtually, sending people the sensor and instruction. That study will take us about 6 months. The problem is we need funding to do it. It's expensive. But once we have it, that's the purpose of our seed raise. We can move very quickly. The next step is FDA clearance. So in order to get FDA clearance, that would be a follow-up study or an extension of the first study.
You have the hardware. You have your algorithm to be able to find the signal. Yep. And now it's just about putting it all together, running a clinical trial, and moving forward. Okay.
We've been able to use machine learning to decode the brain signal fairly accurately in 18 individuals. That's our training set right now for our machine learning algorithm. Imagine if we had 300, 600. The signal is very robust because this is an inherent biological function of everyone's brain. This functionality is strong, highly reproducible. And once we have the training set to really optimize our algorithm, we'll get that FDA clearance and be off to the races.
Dr. Halpern says if everything goes according to plan, funding, execution, no major surprises, they could be looking at a market launch in about 18 months. But when you're designing something meant for everyone, it also brings about bigger questions, like fairness, inclusivity, and who's really being represented.
I always think about the finish line, but I recognize that there's a responsibility that comes with that. This is brain data. So that's something that is very much on our radar, and we have the experts in place to help us with that when the time arises.
How are you addressing that?
We try to decode the brain signal through a variety of different machine learning techniques. One technique that we use routinely, it's not unique to us, is a leave one out strategy. When you leave one out, then you can apply the test set to that one individual whose data was never exposed to the training set or was never part of the training set. That's a very rigorous way to do this. And in some ways, that's a wonderful way to build our community around, because when people adopt our technology, they will improve our ability to be accurate. I love that idea because it's a little bit like Peloton, the idea that you're joining a community and you're helping each other. I think that's very powerful.
The road to innovation is rarely smooth. What is your hardest almost failure moment in building Synch Neuro? One that made you question whether this would ever work?
When we first did our EEG experiments, we didn't use a full scalp cap. We started small and slender, and the signal was pretty good. But we realized in order to get the neuroscience community behind what we're trying to do, we had to start with standard methodologies. We started with intracranial data because I'm a neurosurgeon.
But as the team ventured into surface-level recordings, they took a calculated leap, building a minimal viable product to test the waters. The signals, though imperfect, held promise. Then came the reckoning. When neuroscientists joined their advisory group, the critiques were relentless.
When we spoke to neuroscientists that actually joined our advisory group, there was so much skepticism. Well, it's not really validated for that. You didn't do this. You skipped this step. And so we spent about 6 months all frustrated that we maybe missed the boat. I actually think it was an important use of our time because we actually got a lot of feedback on the hardware and what people would want to see. And actually there was a signal there that was pretty promising anyway, but we had to take a step back and go back to full scalp EEG caps. And then of course we reproduced the finding, and now we're back to focusing on our minimal viable product and building our prototypes.
It sounds like you needed to do this one step to build your credibility.
I would say a combination of credibility, which is important. This is going to be an FDA-cleared device. The FDA may have required it, but also maybe a little bit of a mechanistically rigorous method and a validated method. We've used full scalp EEG for decades to understand brain data. We've never used behind the ear EEG to do that.
Yeah.
So
it seems unbelievable, Julie.
It does. It's a little bit science fiction. But once we had that full scalp array, we saw the signal, we replicated the intracranial data. But we also realized that the signal on the forehead was not very strong. But it was actually when you got to the sides, the temporal bone and the bone a little above where the mastoid is behind the ear. Well, it's strong bone quality, but it's very hollow and it's relatively thin. And the brain signal, the EEG signal, was the strongest. So it gave us an opportunity to not only feel confident that a wearable behind the ear would work, but scientifically, we then had the sort of validation to take a wearable approach. And the EEG community would then understand, wow, they wheeled down EEG in a way that made sense, except at first it seemed like we just skipped a huge step. And that was a scientific mistake, but one that we owned, and it delayed us a little bit. Luckily, we were able to get some more funding from our angels, and we're back doing what we intended to do in the first place.
The wearable market is crowded. Dexcom, Apple, Emotive, Neurosky, Evolve Technology, and many companies, and companies that have a lot of money, are racing towards non-invasive glucose monitoring. It's becoming a catchphrase. How are you going to differentiate your solution with these companies?
A couple of ways. I'm a deep brain stimulation surgeon, right? I take care of Parkinson's patients, and there was a time when Medtronic was the only company that had these devices. The amount of innovation and benefit to patients dramatically improved when competitors came into the marketplace. And, Parkinson's is not a very common problem, relatively speaking. But there's probably 1 million people in America with Parkinson's. We've got 3 device companies competing for every one of them. Continuous glucose monitoring, the realm of pre-diabetes and diabetes. I mean, this is 100 million Americans, a massive market opportunity. There could be 12 competing companies and they could all be profitable. That being said, our device is extremely well protected from an IP standpoint. Our strategy, when we formed our company, we formed with the guidance of a business advisor who I was introduced to by my patent attorney. We've been working on patents protecting the mission of this company for 3 or 4 years now. It's certainly possible that Apple and other companies could go after this. The beauty of what we do is extremely simple and extremely affordable. There's other kinds of technologies out there for non-invasive sugar monitoring using infrared and sweat. The issues with those is the sort of time sensitivity, the lack of temporal precision that sweat will provide, for example. These non-invasive sugar monitors using a watch like Apple, I highly doubt that they will be able to match the accuracy of a standard CGM. So I worry that the kinds of insights they're going to provide are going to really be flawed, and they're not going to move the needle and help people with prediabetes prevent type 2 diabetes.
It's like seeing only a few frames of the movie and not watching the entire. Yeah. We need a better way for sure. Yeah.
Some of them are also taking a consumer approach, so they won't be able to give actual levels of blood sugar to individuals. And we've learned from our users that's very important. And doing that non-invasively, I think, would be near to impossible.
Next up, can a medical device truly become a fashion statement? What if it's not just a brain wearable, but a revolution where health is no longer just a necessity, but a symbol of identity? Plus, Dr. Halpern credits the guidance of seasoned disruptors, individuals who know how to make consumers obsess over a product. According to the American Health Association, 30% of consumers abandon their wearables after 6 months, and 50% after 1 year. Among the top reasons, lack of comfort and a poor user experience. So what makes Synch Neuro's user experience different?
Some of our designers have actually told us they think that people will want this to not be discreet, that they want this to be like a piece of jewelry. And I credit Aura and Whoop, that they've made their devices cool. And I think that's really important. Our device is going to be this first brain wearable, and people will want to join our community. This will be something that people will want to be a part of, and we'll design it in such a way. The hardware and the software are really designed for our users to get healthier, but keeping in mind that it's something that will be a symbol for them that they're prioritizing their health. And that's something that I think is going to be really important going forward for the masses of people that need this technology.
Wearable tech is booming, growing at 14.6% a year. But potential alone isn't enough. Taking it to the next level takes the right resources and smart execution.
We're trying to raise $5 million to basically get us to our Series A. We'll go to market. We've had great feedback from investors so far. We've probably pitched to about 30. We probably need to triple that, at least. We're a bit of a tweener. So consumer go-to-market experts, they don't like the FDA. Medical device experts, they don't like the direct-to-consumer approach. Maybe we need a co-lead, or maybe we need a lead investor who's willing to work with other investors. But when we've gone to some of these VCs, that's the feedback we're getting. We're not so comfortable with the FDA thing. And I keep telling them, well, it's just FDA clearance. 510K de novo could take 6 to 9 months. This is not a 5-year plan. But they've heard horror stories about how long the FDA could take, so they really avoid it. And
they're not confident because you haven't gotten the FDA clearance yet.
Correct. And of course,
but you need the funding in order to be able to do it.
Exactly. So we're hopeful that we will get that lead investor in the next quarter or 6 months.
A lot of neuroscientists were questioning exactly what you were doing. And you might show them how you could do this in a 26 electrode, and even that you're doing it with a single electrode, but still bringing change is difficult. There's so many established giants, and you have to change the game for good. What is your market penetration strategy?
The users will dictate how this goes. We've designed a device, an app. We designed the readouts that fits what our interviews with these individuals have guided. And we want our users not only to feel like we're meeting their needs, but to really be obsessed with what we're doing. That goal was inspired by really two people who have been friends, advisors for the company, Emily Hayward and Ben Lair. These are individuals who know how to bring things to market. They know how to disrupt. Ben told me he likes to break things. And what he means by that is when you have inefficiencies and things that aren't really working so well, we got to make them better. Emily has worked with so many consumer companies and figured out ways to get people obsessed with these products. Think Allbirds, think Casper. We are a company trying to put health in people's hands. I don't have to worry so much about, are the hospitals happy with that? Are the doctors happy with that? They don't have to get insurance coverage for our device. We intend to be a subscription device that's cheaper than a Netflix subscription, less than $10 a month. We don't need insurance reimbursement, although we intend to get it because we'll be FDA cleared. But it won't be necessary for us to scale. So I think that the healthcare community will embrace it. Doctors can actually bill for their time in how they interpret the data that we're providing them.
How do you envision this technology transforming chronic disease management?
It's a really good question. The brain is a prediction machine and it knows all. So where are we going? I really do believe that the insights the brain data can provide can reinvent and define preventative health strategies. People in the front lines of medicine, they don't have the bandwidth to see 100 million people with prediabetes. People with prediabetes are told they're not sick enough to have a doctor. They need a health companion. They need a wearable that can give them the insights they need. But we're going to do so much more than metabolic monitoring. The idea that we could be a helpful monitor for people with addiction is real. We have IP on this. It's something actually we formed the company to do originally. Athletes, I think, could really benefit from this. One investor told me when athletes retire, when coaches retire, they often suffer from poor health because they lived a life of extreme activity. And then all of a sudden, they're no longer playing at that level or exercising like they used to. So that's chapter 1, maybe chapter 2. Where's chapter 3 and 4 going? Well, we already have evidence that with brain data, we can tell you what your heart rate is. And so we could be a wearable EKG that is discrete, much more comfortable than a Halpern monitor or any other type of heart monitor. We can provide insights into blood pressure and things like stroke risk, epilepsy. So we actually see our device not only empowering the user, but allowing doctors to scale what they do so that preventative medicine actually works. We'll also be able to triage to deep subspecialists who could actually intervene on critical problems that our technology sheds light on.
Imagine a world where medicine isn't just trial and error, but built just for you. Looks at your genes, your lifestyle, your environment, and everything that makes you you. There's no guesswork. No one size fits all, and that's the life that we've been living in all this time.
Yeah, there's way too much trial and error. I think that's very well put.
What advice would you give to entrepreneurs just starting out or on the cusp of the next thing?
I have to come from a humble place because I do consider myself a clinician entrepreneur, but I haven't brought a product to market yet. I guess you can say I've dared to try. When I was in high school, my cross-country coach wrote me a letter at the end of my first season, and he said, "I'm proud of you. You dared to try." So I think that's actually my best advice is dare to try. And it's our clinicians that have access to the opportunity to have a novel idea that could help somebody. So often we're in a position where we wish we could do something different. And so I would say, let's not be scared of taking a risk. And I've always said, you got to do what you love. You got to do what you're passionate about. So I suppose blending those two pieces of advice, if you have that urge, go for it. Of course, there's still risk, but if you're passionate about it, there's a higher chance of success.
That's an interesting way of looking at it, that passion de-risks you. I've never thought of it like that. What are you risking if you're passionate? You're doing something you love anyway.
A lot of people in neurosurgery face a very difficult question, like, do they want to do clinical neurosurgery or do research or both? I do both, but I do both because I can't think about operating without thinking about the opportunity that provides for research. And the research that I do, including the work that Synch Neuro is doing, it keeps me awake at night. But it's because I'm passionate about it and I want it to be successful more than anything. I luckily have a spouse who's very supportive. Herself is very entrepreneurial. And we do have 2 young children that are in private school. That makes all of these things hard, but, one step at a time.
So, love to end on a light note and ask our guests what books they are currently reading to get a glimpse on your personal life.
I just finished Hamilton. It took me a long time because it's really long, but the Alexander Hamilton biography, which inspired the Broadway show, which my family loves. We've seen it 4 or 5 times. My daughters are obsessed with it. They know every word, like many children these days. Hamilton's probably the best entrepreneur in the history of our country and just had every obstacle against him. And we are all successful these days because of him, and we probably don't credit him enough. The other book that I've recently finished is a book called Untangled, which is about raising teenage daughters. So on a lighter, more personal note, both of my daughters are entering into the teenage realm, and my gosh, this book was very helpful. Highly recommend it.
Dr. Halpern, I'm very excited about what you're looking to bring to the world and just that potential of harnessing the power of the brain's electrical signals and a non-invasive way to track our glucose, empowering the patient and putting data in our hands and looking to see to how we can improve our longevity with tools like yours.
Thank you so much, Rajni.
Thank you so much, Dr. Halpern.
Likewise. Thank you so much for having me.
Hey, quick question. Have you subscribed to this podcast yet? If not, what are you even doing? If you've had fun with this episode, go ahead. Hit that subscribe button. Share it with your favorite friend and drop us a review. Yeah, we actually read them and do a little happy dance. Dr. Halpern's work with Synch Neuro is next level stuff. So if you're even a little bit into brainy tech, wearables, and the whole future of health thing, you definitely don't want to miss what's coming. Thanks for tuning in. Stay curious, stay inspired, and keep geeking out with us.